So something I get asked pretty frequently is what is dry needling and what are the benefits? So dry needling uses small microfilament needles to target specific tissues in the musculoskeletal system. So for Steven in particular, we're gonna hit QL, which is the quadratus lumborum muscle of the back, and some paraspinals in his back. So what we're trying to do though is target specific muscle trigger points, scar tissue adhesions that kind of develop and build up in this area. Now, dry needling is good for a lot of conditions: chronic, acute, overuse, sprains, strains. If it has a muscle, tendon, or ligament, we can dry needle it pretty well. Great modality for injuries. It improves range of motion, reduces pain, sensitivity to areas, and just stimulates the body's natural healing response. So it's one of my favorite therapies because it's very effective and has very strong benefits. So, all right, Steven, you ready?
Mm-hmm.
All right. So we're using these small microfilament needles, and small as far as diameter. So as far as diameter, they're about 4 to 5 times smaller than an injection needle. So pretty small. Steven, how's that?
Feels good.
Okay. So most people describe this as a initial pinprick and a little bit of a dull, achy sensation as the needle becomes inserted into the tissue. At times you'll have what's called a twitch response, where the muscle will involuntarily contract, and that's totally normal. We're actually looking for responses like that. We're usually hitting a trigger point, and it's almost like a reset. You felt one right there, huh?
Mm-hmm.
Yeah. Of the anatomy in that area. So that usually tells us we're in a good area. And then once all the needles are put in, we're actually gonna hook up a stem unit or a TENS unit to the needles themselves. That's gonna send electrical signals to the muscle itself. And in Steven's case, I'm gonna do it in a way that stimulates the muscle to fatigue it in order to allow some relief of symptom and pain. So again, one of my favorite therapies to perform on everybody. And if you're scared of needles, obviously, we won't needle. So, all right, that was the last one, Steven. We're gonna start on the other side. So as far as like contraindications to dry needling, we never want to go to an area that has a fresh cut or wound. People with diabetes that have neuropathies, anywhere in the abdomen that's close to organs, pregnant women if we're going near that area. But dry needling can treat post-surgical conditions like scarring, adhesions, limited range of motion, as well as improved blood flow to that area if we do it in a certain method. So super cool stuff that we can do with dry needling. It has multiple uses. All right, Steven, we're gonna start hooking up that machine. So okay. This is just a TENS unit, and we're gonna run some wires up through that area. Some people say it looks like I'm hooking up a car battery to the site, which is funny to me, but all it's sending is an electrical stimulant to the area. All right, Steven. Make sure you got the right ones. Okay. Let's start with this middle one, okay? And then we'll go to the outside. So all we're looking for is a heartbeat contraction, just a little bit of a pulse of the muscle like that. If there's a sting or a bite, he'll let me know and I'll change and modify it. But for the most part, it should be tolerable to his level of comfort. Let me know when you start feeling it, Steven.
Feeling it?
Okay. Just a pulse?
Yes.
Okay. We're gonna go to the outside portion, okay? Same thing, let me know when you start feeling it.
Feeling it.
Okay. Just a pulse?
Yes.
You wanna take either one up or are you good there?
I think it's about right.
Okay, let's stay here. So, we're gonna leave Steven on here for about 4 to 5 minutes. We're gonna check up on him. Sometimes we see a bigger muscle contraction of that area. Sometimes he feels a bigger muscle contraction that we can see visually, just because visually I'm just superficial, but we're going a little deeper. So he'll feel it along the deeper layers of anatomy. So as long as he feels a contraction, the machine is doing its job and the needles are doing its job. So we're just facilitating the back to do its natural healing response. Let go of some of this tightness through here and relieve some pain and irritation through here. Cool, so 4 minutes, we'll pull them, we'll do some exercises, and then we'll adjust. Cool?